Welcome back to our channel. Today, we're diving into the world of psychology to discuss a crucial tool used by mental health professionals, the DSM-5. So, what exactly is the DSM-5 and how is it used? Let's find out. The DSM-5, also known as the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, is a comprehensive classification system published by the American Psychiatric Association, APA. It serves as a universal guide for diagnosing and categorizing mental disorders. The DSM-5 builds upon its predecessor, the DSM-IV, incorporating significant changes and advancements in the understanding of mental disorders. Its primary goal is to provide a standardized framework for diagnosis, treatment, and research of mental illnesses. The DSM-5 classifies and describes various mental disorders, offering diagnostic criteria and a common language for mental health professionals to communicate effectively. It covers a wide range of disorders, including neurodevelopmental disorders, mood disorders, anxiety disorders, psychotic disorders, personality disorders, and substance-related and addictive disorders. Each disorder is described in detail, providing information on its diagnostic features, prevalence, associated symptoms, and suggested assessment measures. The manual presents the diagnostic criteria in a systematic manner, outlining the specific requirements for each disorder's diagnosis. So, how is the DSM-5 used? Mental health professionals, including psychiatrists, psychologists, and therapists, rely on the DSM-5 to diagnose mental disorders. When a patient seeks help, clinicians use the manual to assess the patient's symptoms, evaluate their severity, and determine whether they meet the criteria for a specific disorder. The diagnostic process involves careful evaluation of the patient's history, symptoms, and functional impairment. Clinicians consider the duration and intensity of symptoms, as well as their impact on the individual's daily life. One of the significant advantages of the DSM-5 is its emphasis on consistency and reliability in the diagnostic process. By providing clear guidelines and criteria, it helps ensure that different clinicians arrive at similar diagnoses when presented with the same set of symptoms. This consistency is essential for effective communication, research collaboration, and treatment planning. The DSM-5 also recognizes the concept of comorbidity, the co-occurrence of multiple disorders in an individual. Comorbidity is common in mental health, as many disorders share risk factors or have overlapping symptoms. The manual helps clinicians identify and address comorbid conditions, allowing for a comprehensive understanding of the individual's mental health needs. The DSM-5 plays a crucial role in treatment planning. It guides clinicians in selecting appropriate interventions based on the specific diagnosis. Different disorders may require different treatment approaches, and the manual provides insights into evidence-based treatments for each disorder. Cultural considerations are also taken into account in the DSM-5. It recognizes that cultural factors can influence the presentation and understanding of mental disorders. Clinicians are encouraged to consider the cultural context, norms, and values of the individual being assessed to avoid over-pathologizing normal variations in behavior or culturally sanctioned beliefs. While the DSM-5 is widely used and considered a valuable resource, it has also faced criticism. Some argue that its categorical approach may oversimplify complex mental health issues and potentially lead to overdiagnosis or underdiagnosis. Critics also raise concerns about the influence of pharmaceutical companies on the development of the manual, suggesting that it may pathologize normal human experiences and promote a reliance on medication as the primary form of treatment. Despite the criticisms, the DSM-5 remains the most widely used diagnostic tool in the field of mental health. Its comprehensive classification system provides a common language and framework for diagnosis and research. It enhances communication among mental health professionals, shapes mental health policy, guides treatment planning, and facilitates research collaboration worldwide. And that's a wrap for today's discussion on the DSM-5. We hope this video has shed some light on this important tool in psychology. Remember, the DSM-5 is just one component of a comprehensive assessment and treatment process. If you or someone you know is experiencing mental health difficulties, seeking help from a qualified mental health professional is essential. Thank you for watching, and don't forget to subscribe to our channel for more informative videos on psychology and mental health. Take care and see you next time.